So we are going to do a vent checkout. So what we're going to do is we're going to go into system check. It's going to tell us in here when the last check was. So what we're going to do is go into device check, start there, and all we're literally going to do is press start. So you do have to be hooked up to, you have to have the vent plugged in obviously, and you have to have air and oxygen hooked up for this. I'm going to press start, click. It's going to ask us questions now. So do we hear an alarm? Yes. Yes. Is the breathing circuit connected correctly? We set that up already, so we know it is, so yes. Is the humidifier connected correctly or not used? So in this case, it's not, humidifier is not used because it is a dry circuit. We always have an HME in line, but we will put yes to this. Just know that it's not used. And do we want to calibrate the expiratory flow sensor? Yes, we always do. And it's going to say, is it fitted correctly? Yes, we know it is because we put the circuit on previously. And do we want to calibrate the neonatal flow sensor? In this case, no, because we have it set up as an adult ventilator, so we're going to say no. And now, is the test lung connected to the breathing circuit? So what we're going to do is take that part off, connect the test lung to the circuit, and press yes. And do we want to calibrate the internal gas supply sensors? It can take up to 3 minutes. We always want to do that, so we press yes. So we can put this here. And unfortunately, this part is just wait. So you'll see it going through here, and it's calibrating them, so we'll just wait. And so this is probably the time that when it's doing this, I might go grab a end-tidal CO2, the ones for the ventilator, and put it on top of here. This vent doesn't have one on it, but also I might put an inline suction catheter on top just while I'm waiting. And so the vent will make noises. That's all normal. And once it's done the gas supply sensor calibration, it will start going through the rest of the test itself. And then now you'll see it's done. And so once it's done, it starts doing the rest of the checkout all by itself. So it's gonna, you'll see O2 supply, air supply, so it does need to be hooked up to do that, as I previously mentioned. And once it's done these 2 checks, it goes through the rest quite a bit faster. Oh. And you'll see it's still moving on. So in here, green obviously means it passed the check. If it was red, it would have failed. And then when it's blank like that, it just means that we didn't do it, which we did say no, we didn't want to do the neonatal flow sensor. Now we're just waiting on the last 2 checks. Perfect. So in here it's going to say device checked finished. So it's done, it's finished, it's all green, it's good to go. To proceed to the breathing circuit check, touch yes. So yes, we do want to do that. So it's going to tell us it's incomplete. It's always going to say that because we didn't do the neonatal one. That's fine. We know it's incomplete. So in here, we're going to do the breathing circuit check. So we are going to press start. It's going to say make sure no patient is connected and confirm. So that means I can't have my test lung connected. So I'm going to press start. It's going to say connect breathing circuit, seal patient connection port, and confirm with OK. So that's where I'm going to use this, and it's sealing it with the red cap. Press OK. So if we had a leak in our circuit, this is where it's going to show up. So here it's saying leakage, and it'll always have a small amount of leak. So acceptable is 300 milliliters per minute at a pressure of 60. So it's under it. If we did have a little leak in the circuit, this is where you're going to see it. So it asks us to open it and then confirm with OK. So the breathing circuit check is finished and leak check is good. So if we had, say, a small leak somewhere in the circuit, I will just maybe take this on. Not that off. I'll take it off from here. So I'm going to make a small leak in the circuit here. I've taken that off. And then when we went through here to start, make sure no patient's connected. Seal it. When we do our leak check, it's going to say plus, plus, plus. That means we have a big leak somewhere and it's not going to pass. So this is a good way to troubleshoot, that if there's a leak somewhere in your circuit. It won't tell you about a leak on your patient side, like in the ET tube with the cuff, anything like that, but it will tell you if you have a leak in your circuit. So I'm just going to cancel this because we know it's not going to pass. And it's going to tell us it failed. So defaults are used. So before I put this ventilator away, I'm just going to redo the breathing circuit check. So open it, press OK. Now it's finished. So check results, we're all good. Overview, so we can get out of the screen. So now it's going to say on September 29th, it was partially successful. The reason it says that, again, it's not something that we can control. It's because we didn't do 2 of the checks. And we're not going to because we're not using a neonatal circuit. So now that we're out of there, we can go back to start standby and we could use the vent. And you're going to see a little green thing here saying breathing circuit check, but again, that device check is going to look like it's not completed. But we do not want to complete those 2 parts at any rate.